two key challenges for effective healthcare delivery in India. One is realizing that there's a very large community and it's not just a bottom of the pyramid phenomenon. It's actually it tends to be, even a middle class or upper middle class. They all have health challenges. The second big challenge is clearly around the ability to pay for services and pay for access to information. Innovation has to happen at a lower price point in India just in order to meet the needs of our community.
Healthcare is typically a pyramidal structure where the bottom is the primary, then comes the secondary, then the tertiary care. In India, there has been fantastic movements in the secondary and the tertiary care fields. As you know, the big hospitals have come in. But nobody has thought about the bottom of the pyramid, which has to cater to the community.
I think that would be the mobile aspect of our company, that our content is readily available over mobile devices. So we launched our mobile video content earlier this year in 2011, and in just the first 6 months of 2011, we've seen a 10x increase in the amount of videos delivered. And the vast majority of our video views happen on a mobile device.
In any healthcare model, the crux is a medical record. In India, there is no place where you keep a patient's central medical record. Nationwide has brought about something which is called an electronic medical record, where all its registered members have their database of their medical history compiled in one position, which is mobile, which is accessible on the web. We provide 24/7 cover. In the community, nobody provides 24/7 cover here because they can't do it in an individual practice. But as we are a conglomerate of general practitioners, it helps us to provide that service as a group.
I'm here because we're now focused more on the health space and trying to understand the patterns and trends around this area.
The value that it creates is new conversation, which is very important, new connections, so that you start thinking and working in new ways, really. And that's important because each one of us works in their own space, so we have only one way of looking at things. But when we come together, we look at the same problem or the same opportunity in new ways.
Innovation Alchemy is doing a fantastic job in creating a dialogue around innovation. What is innovation? How do you grow innovation? What are the different ways people, especially in the social sector, are looking at innovation? So I think that knowledge and also the platform to be able to interact with people who are working in this space is very, very valuable.
What I found really interesting was the diversity in the audience. So you have people from varied backgrounds like design, from the medical profession, entrepreneurs, people who are looking at investment opportunities, and people from advertising. The diversity that the audience brings and the perspective therefore and the kind of questions and the issues that are raised and the discussion that happens, that makes the entire discussion around innovation, design, and that's the magic.